Medicare Part D. It's come in 40% below cost projections. Now, while those savings can be attributed to lower than expected enrollment, CMS calculated that nearly 85% of the program savings were, quote, a direct result of competition and significantly lower Part D plan bids. I mean, the premiums, I remember we had an amendment in Ways and Means to lock the premiums up at a rate that would be about 25% higher than they actually are today. The reforms in our budget are modeled on these kinds of reforms. Seniors choose from a set of guaranteed Medicare-approved coverage options. So when analyzing projected costs under the House-passed budget, did you take into account the effect of choice and competition would have on the growth rate of healthcare costs? And do you assume people will continue to utilize health services at the same rate as they do now? Meaning, what I got out of what you just said is that you're not really gleaning those kinds of lessons from the experience we have from the Part D results.
So we are not applying any additional effects of competition on this growth rate over time in our analysis of your proposal. And we don't have, again, the tools, the analysis that we would need to do a quantitative evaluation of the importance of those factors. I think interpreting the Part D evidence and interpreting other evidence in the world is complicated. At the time of the Part D estimate that we made, which was above the ultimate cost, prescription drug spending throughout our healthcare system was rising very rapidly. We expected it to slow. It slowed much more abruptly throughout the healthcare system than we had anticipated at the time. Part D shared in that slowdown. That is, again, a healthcare system-wide phenomenon. The extent to which that was passed through to Medicare Part D in a way that it's different than it would have been under an alternative structure for Part D is a more subtle analytic question. And if one looks at other examples of where one tries to compare the public, more traditional healthcare programs to systems where there are competition among private insurers,
right.
The comparisons are not so straightforward. There are, as we show in our report, there are periods of history when costs in the public programs have grown faster than costs in private insurance, and there are periods where the opposite can be seen. If one looks at FEHB, the Federal Employees Health Benefit Program, premiums in that program have risen fairly rapidly, along with premiums in the rest of the healthcare system, roughly, despite the competition that occurs there. But interpreting this evidence is tricky. We have public healthcare programs that have evolved over time with a lot of policy changes. It's not a clean run of a certain set of policies. We have a private healthcare system that's been affected by developments in the public healthcare system, that's affected by the tax treatment of employer-sponsored health insurance. So it's not a clean run of a purely private system either. So what we're trying to do, but this is a long project for us, is to glean the lessons from these different parts of our historical experience to try to address the central policy issue you raise, which is the power of a public's defined benefit healthcare system versus a system where the government makes a defined contribution to competing private insurers to try to give you some more analytic.
And that's what I want to encourage you. Look, you guys are doing a lot of, Joyce's whole shop over there, you do such great work. But if we stick with the analytical tool we have, or the lack of tools we have, then the only conclusion is price controls. And I think economic evidence throughout history shows us what happens there. So I think we've got some work to do to really analyze this. Any plan, put ours aside for a moment, any plan to address this fiscal crisis obviously must address healthcare programs and health inflation. And measuring any of these plans against what is really a fiscal fantasy, which you're acknowledging, an unsustainable trajectory, is really not an accurate measurement or comparison, because it's comparing some plan against a future which we now know can't continue. And so I think we all have to do more work to try and figure out how to really, truly address these issues. I'll leave it at that, because I wanted to get into the budget.